Hello, everyone, and welcome to Shine Chats. My name is Scott Jackson. I am the Executive Director of Henry Schein Surgical Solutions, and joining me today is Bill Prentice. Bill is the CEO of the Ambulatory Surgery Center Association, otherwise known as ASCA. Bill has been with ASCA for over 10 years, and his career spans over 27 years in professional capacity, working with various healthcare organizations. And also, he's done quite a bit of work on Capitol Hill. So, Bill, thank you for joining us. We're very excited to have you.
Thank you, Scott. It's a pleasure to be here with you.
So Bill, you've been very busy over the past couple of months. You're coming off the tail end of your annual conference. And having said that, could you give us a high-level state of the industry, things that we should know about the ASC industry today?
Well, sure, Scott. And obviously, the last year and a half has been unprecedented in terms of the impact of the COVID-19 pandemic, on our lives, but also on the way our healthcare system has worked, the way the patients have interacted with it. Obviously, for a couple of months earlier last year, we were actually shut down, only providing care to urgent patients, who needed really care right away. And that obviously had a big financial impact on ASCs for a while. I'm really pleased to see the way that we bounced back. I think that the ASC model and the fact that we are off a hospital campus has, I think, made patients feel safe and secure to go back and get their care. We're still trying to catch up to all that care that was postponed in March and April of last year, but we're getting there.
Well, and that's good to hear, Bill. Obviously, last year was quite unusual. There was a pretty significant shutdown really in that second and third quarter. And I guess from your membership perspective, do you feel that those electives are bouncing back at this point, or do you still think there's somewhat of a pent-up demand that still hasn't gotten through the system?
I think there's still some demand, but I think the polling that we've done of our members over the past 6 months, we've seen a pretty good bounce back in terms of patients coming to get the care they need. I think particularly now as people are getting vaccinated, I think that backlog will disappear. There's still some challenges. I mean, I think cases still take a little bit longer because of the extra protections and precautions that the facilities are taking to keep people safe. The cost of supplies is an issue and something that's challenging ASCs around the country. But by and large, we're feeling really, really bullish about the future of the ASC model.
Well, and that's good to hear. And when you think about some of the opportunities that the ASC industry faces, we've heard comments that the COVID situation may actually help the industry in the sense that many procedures that otherwise would not have migrated to ASCs have done so. Having said that, if you think about some of the headwinds and the tailwinds that are facing the industry, what are some of the, maybe start with the headwinds, but what are some of the challenges that face the industry? And then maybe segue to what do you think some of the greatest opportunities are?
Sure. I think the primary headwind is when you think about the types of patients that go to ASCs, and particularly think of the Medicare population. Medicare reimbursements are still a challenge and a big impediment to having more care being provided in the ASC setting. That's something that we're obviously working on with our advocacy. I think that when you look at tailwinds, I think this last year, tragic as it has been, it has really, I think, shown the value of having a decentralized healthcare system. The fact that we have ASCs and hospital outpatient departments that are off of the hospital campus, meaning that they're sites that we can keep, kind of safer than an inpatient hospital dealing with, a live pandemic, and patients can go and still safely get care. So I think that there's been a lot of recognition over the last year of the value of ASCs in that regard, both from the federal and state policymaker level, as well as I think is the larger healthcare environment overall.
And that makes sense. And, you, like we mentioned earlier, you just came off your annual meeting. It was virtual,
Mhm.
but nonetheless, it was relevant as always. And when you look at some of the topics that were discussed at the meeting, and you think of your members, what were some of the themes that you took away from the meeting, as far as what your members are saying, and maybe provide a voice of what's top of mind for these ASCs and these administrators and the owners today in this market?
Well, I think if you look at our agenda and the topics that we had on that agenda, I think patient safety and quality are always near the top. And I think particularly in light of what we're going through right now with the pandemic, that's never been a more important topic. So I think that those issues are front of mind with our members. As you mentioned, we had our second virtual conference. Did much more successful version this year than the one we had to kind of hurriedly put together last year, as the pandemic was starting. But I will tell you, we're all really looking forward to being back live in 2022. And so, God willing, we'll be in Dallas, Texas next April, and be able to meet together, and work on the issues that are important to our members.
Yeah, no doubt. Hopefully, this is the last virtual meeting that we all go through, and we do look forward to the live event next year in Dallas. One other question related to the industry is, when you look at the ownership, you have different types of ownership within these ASCs. Some are completely physician owned. Some might have a corporate ownership along with physicians, and then you might have an IDN with corporate and physicians who all have ownership. Where do you see that trend over the next handful of years? Do you still think that it will remain heavily physician owned as it is today, or do you see a different shift in ownership over the course of the next handful of years?
I think there, as you mentioned, there are all those varieties of ownership. I think you left out hospital physician joint partnerships, which is also a pretty significant one. I think the beauty of the ASC model is it can adapt to each of those structures. I will tell you, I think the physician ownership is critically important, because I think having the physicians who are actually practicing in the facility have an ownership in everything that happens in that facility, I think it really leads to the focus on efficiency and patient satisfaction that the ASC model has always shown. But I think that there is, I think, an opportunity for every one of those structures to succeed in any given market. I will tell you that I think that over the past year, again, I think with the struggles with the pandemic and the issues with being closed for a couple of months, probably made some physicians look for partners as a way to try and protect that surgery center and its ability to provide good care. But there's still plenty of great of physician-owned facilities around the country working independently, providing great care. So I think there's room in the marketplace for each model.
When you look at some of the work that you and your team have done, and by the way, your association has done some really, really great work on behalf of the ASC industry, and a lot of that takes place on Capitol Hill.
Right.
And I, not to underscore the work there, but could you talk a little bit about some of the work that you have been doing on Capitol Hill, and some of the work that you think will take place on behalf of the association on Capitol Hill?
Sure, and I thank you for that compliment, because I think we do work really hard on behalf of the ASC community, representing them here in Washington D.C., both on the legislative side in front of Congress, on Capitol Hill, as well as with the federal agencies that regulate ASCs. And we're a very small player in terms of our number of lobbyists, or ability to get around the Hill compared to some of our larger competitors in the healthcare environment. I think we make up for that, though, by being smart on the issues that we lobby on. I think we're right on the issues, and I think that gives us the ability to get traction despite our small size. And when I think about the big challenges we have ahead, I'd already mentioned payment, and I think that is something that we really do need to come to a reckoning in terms of the Medicare program, in terms of trying to find ways to encourage beneficiaries to go to the more efficient setting to get care. if they can get the same quality care, but the system pays less, I think we all win. And that's something that is first and foremost in terms of our advocacy.
Well, no doubt. Better care, or as good, if not better, at a reduced price is great for the healthcare system. It's good for all of us as consumers. And but again, the work you've done on Capitol Hill has been quite spectacular, I think, over the past decade or so, and it has helped the industry in many ways. So, final question for you, Bill, and I know you don't have a silver ball here, or you can't really look into the future and know for certain. But if you were to look at the next 10 years out, what do you think the industry will look like in 10 years? Do you think it'll be very similar to what it is today? Do you see some very major changes that will take place? What are your thoughts on that?
Well, I think if you look over the next 10 years, I think everyone is predicting that more and more care is going to be provided outside of the hospital, in an outpatient setting. And I think that's just going to grow over the next decade. We're going to see, more procedures in the inpatient hospital. I think we're going to see more patients getting care in an outpatient basis. And I think, of reasons for that. One, I think obviously there's the efficiency, the fact that we know that, we can provide care less expensively, outside of the hospital. But then I think you combine that with the clinical advances that we're seeing, every year in terms of the ability to provide more and more care, in an outpatient basis, the improvements in anesthesia and pain control, the greater understanding by the patients themselves that they have an opportunity to get care in a more patient-friendly setting. I think all that's going to lead to growth, in the ASC arena. I think that, again, reimbursement is the big challenge. But I think if you look at the growing cost of healthcare in this country, and the never-ending search to trying to find a solution to that, and to try and control healthcare spending in this country in a way that makes sense, I think if people look to the ASC model, they're going to see an example of how that can be done while still providing high-quality care. So I'm really bullish on the ASC model over the next decade. And I think that, as long as our healthcare policymakers at the federal and state level look at the facts, look at the data, I think we have a great future ahead of us for the ASC community.
Well, and that's exciting to hear, Bill. And a couple of things I'll say to close this out. First, thank you for taking the time. This has been a very busy month for you with your association and the show that you just had this past week. So we thank you for joining, and we sincerely thank you and your team for the great work that you do every day on behalf of the industry. And it's very much appreciated, and we thank you for that. And for those of you watching, we hope that you can join us on future Shine Chats. Thanks so much.
Well, thank you, Scott. And I just want to say on behalf of the ASC community, we appreciate all the great, work that Henry Schein does in our space, and the ability to provide products that at a fair price that allow us to still be the efficient provider. So continue your good work as well.
Thanks so much, Bill.